Good morning. My name is Angie Catherine Infante Sandoval. I am studying psychology, um, psychometry, work, psychology case. Lorena case. Lorena is a 12 years old 7th grade student at a private school in La Mesa, Cundinamarca. Over the past few weeks, she has experienced episodes of irritability, crying in class, and declining academic performance. The school psychologist, without conducting a complete evaluation, decides to administer a projective text with the start text, a student to complete unsupervised, and in a short interview with Lorena, based of these two elements, she informed the parents that the teenager is showing symptoms of depression and confirming psychiatric treatment. She also shares the information with teacher and informs the school. The mother, alarmed by the diagnosis, goes to a hospital for a more thorough evaluation. It is concluded that Lorena does not have a depression disorder, but rather an emotion reaction to the given process for her grandmother that case analysis. The school psychologist violated Article 47 by using a diagnosis based on a single text and a brief interview, instruments lacking sufficient validation. No mention is made of whether the projective test used was valid or standardized for Colombian adolescents. In the Q diagnosis, unnecessary alert was generated in the family and the possible initiation of inappropriate medical treatment. Lack of contextualization. Lorena context grieving for her grandmother was not taken into account. Confidentiality in anonymity. She disclosed the information and exposed the student. Article 45 is psychoteaching material is for the exclusive use of a psychology professional. The school psychology instructed her intern to perform the test when the legal requirement was for unlicensed professional to perform it. A recall for 6. The subtext must complete with the standard for instrument construction, standardization, validity, and reliability. The psychologists did not verify the reliability and standardization validity of the instrument used for the Colombian adolescent population. Article 47. The psychology shall exercise the necessary care in presenting diagnostic results and others inferences based on the administration of texts until they are duly validated and standardized. Her diagnosis was erroneous because she did not perform the necessary text uh, to make a correct diagnosis. Article 4.8. Psychological texts that are in the experimental text must be used with education. User must be made aware on the scope and limitation. In the context present, the school psychologist used a projected text, presumably still in the validation chase or with a low level of standardization as the basis for a delicate diagnosis. Conclusion, I can be conclude that the psychology committed serious ethical misconduct by using a clinical diagnosis with how conducting a comprehensive evaluation, delegating clinical duties to an unsupervised set inter and disclosing confidential information with how consent. This item violated multiple principles established in Law 1009 of 2006, especially Article 48. We require the responsibly use the psychology text and respect for confidentiality. This resulted in emotional, social, and academic harm to the minor. The case highlights the importance of practicing psychology responsibly, ethically, and with respect for patients' rights. Bibliographic reference. Thank you.